One of the things I know we've talked to you in the past about is like, especially in April, it's Donate Life Month. And so you're thinking about transplants and transplantations. There are some people out there who need that to continue to live. How has it been impacted by this?
It's been dramatic. In the United States as a whole, we've done about half as many transplants in March as we did a year ago in March. And for many people, not getting a transplant is a life and death issue. But we have learned from experiences in China, Italy, and in Seattle and New York now that a person who's immunosuppressed and gets COVID-19, they're very vulnerable and they have a high risk of dying. So every case is evaluated on individual risk benefit and risk tolerance. For kidney transplant, which is my passion, it's conceivable that the risk is too high and it's better to stay on dialysis. But you never know when the next kidney offer is going to come because we don't have enough organs for transplantation. There's more than 100,000 people waiting, and last year was the best year ever in the United States for transplantation, but we didn't do more than 40,000 transplants. So there's always a need for organ donation, and April's Donate Life Month, and one of the things that I'm very passionate about is encouraging people to be organ donors, which is a very unlikely circumstance to ever be fulfilled. And it's hard to talk about that when COVID-19 has appropriately consumed our attention and our resources. But eventually we're going to return to a new normal in which transplantation, which depends on organ donation, becomes back to a routine part of our health care.
Best way for somebody to investigate and find out the way to become a donor? I know it's when you get your license, but there are other ways to do it, I think.
That's right. I think, our organ procurement organization partners are Midwest Transplant Network, and they have a great website and a Facebook page and can learn a lot about organ donation and transplantation through those avenues.
And we talked with somebody from that just a few weeks ago, earlier this month, to try to let people know that it is still there. And it's an interesting thing, as you described it, because a donated liver or whatever, kidney, it's there, and you've got a limited time to transplant that, while you can extend on the other end the person who needs to receive it through dialysis or some other means. When there is a donated organ, the time is crucial, and so you're kind of in a bind there. How do we use that? How are we going to be able to use it?
That's right. And you were asking about testing. That's where you have to have that rapid testing to know that the donor doesn't have COVID-19 and the recipient doesn't have COVID-19, and the availability of the rapid testing is very constrained right now. We have a very limited supply, and so it's a new experience on multiple levels.
We have taken more of your time than we said we would, but we appreciate your generosity with it. Thank you so much.
Oh, thank you very much.
Look forward to another visit with Dr. Mark Wakefield, MU Healthcare Associate Chief Medical Officer. This is KFRU.